Pancreatic cancer is one of the deadliest cancers, not because we don't have treatments, but because it's so often diagnosed too late. The early warning signs? Subtle, overlooked, often mistaken for everyday issues like stress, stomach bugs, or just getting older. But what if those little changes in your body were actually big red flags? In today's video, we're diving into 8 advanced and surprising symptoms of pancreatic cancer that you should never ignore, especially if you're over 50. You might be shocked by how ordinary some of these signs seem, but ignoring them could cost you your life or that of someone you love. And make sure to watch until the end because symptom number 7 is one of the most misunderstood signs. It often gets written off as anxiety or depression, but it may actually be a silent clue your pancreas is in trouble. Let's get started. Pancreatic cancer begins in the tissues of your pancreas, an organ tucked behind your stomach. It helps you digest food and manage blood sugar. But here's the scary truth. This type of cancer is a silent killer. Most people don't notice anything's wrong until it's already spread to other organs. But what if your body is giving you quiet warnings way before the diagnosis? New studies suggest that many symptoms show up earlier than we once believed, if we know how to recognize them. Number 1, new-onset diabetes after age 50. Let me ask you something personal. Have you or someone you love been diagnosed with diabetes recently, say in your 50s or 60s, even though you've never had issues with blood sugar before? Maybe you've always eaten relatively well, you're not significantly overweight, and there's no strong family history. Yet suddenly your blood sugar levels are off the charts, or you're feeling unusually tired and thirsty all the time. If that sounds familiar, I want you to pay close attention because this might not be just diabetes. It could actually be one of the earliest warning signs of pancreatic cancer. Here's why. Your pancreas isn't just a digestive organ. It also produces insulin, the hormone that helps regulate your blood sugar. When something interferes with that process, like a tumor forming in or near the insulin-producing cells, it can lead to a sudden and unexplained disruption in blood sugar control. And that disruption may show up as new-onset diabetes. What's even more concerning is how common this link is. Research published in journals like Gastroenterology and the Journal of the National Cancer Institute reveals that nearly 40% of people diagnosed with pancreatic cancer had developed diabetes within the 6 to 36 months prior to their cancer diagnosis. That's almost half of all patients. Yet in many cases, that new diabetes was seen as just another routine health change until more serious symptoms appeared. So, if you're over 50 and suddenly struggling with high blood sugar, especially if you don't fit the typical profile for type 2 diabetes, this is a red flag that should not be ignored. Don't chalk it up to age or bad luck. Talk to your doctor about deeper screening, including imaging tests like a CT scan or MRI if other symptoms are present. Even doctors are becoming more aware of this link. In fact, several cancer centers now recommend that unexplained diabetes in older adults, particularly when it develops quickly, should prompt further evaluation for pancreatic abnormalities. Here's a tip. If you've recently been diagnosed with diabetes and you're also feeling more tired than usual, losing weight without trying, or experiencing changes in digestion, ask your physician for a full workup, not just a prescription. These could all be connected clues pointing towards something more serious. Remember, pancreatic cancer is a silent disease. It doesn't always show up with pain or obvious symptoms until it's already advanced. But new-onset diabetes might be your body's earliest cry for help. Don't ignore it. We're not saying every new diabetes case means cancer, but the pattern is too strong to overlook. Early detection can literally save your life. Number 2, steatorrhea, oily, pale stools. Let's talk about something most people don't like to bring up, your poop. Yes, I said it, and here's why it matters. Your stool can reveal what your pancreas isn't telling you. If you've noticed your bowel movements becoming pale, greasy, foul-smelling, or difficult to flush because they float, that could be more than just a quirky digestion issue. Maybe one of the earliest signs that your pancreas isn't producing enough digestive enzymes. And the reason why? A growing tumor could be blocking the pancreatic ducts, preventing those enzymes from reaching your intestines where they're supposed to help break down fats. The result is something called steatorrhea, which literally means fat in the stool. It happens when undigested fat gets excreted instead of being absorbed by your body. And here's the key, it's not just about greasy stools. Steatorrhea often comes with bloating, mild cramping, or a feeling that your food just isn't sitting right, even if your diet hasn't changed at all. You might think, well, maybe I just ate something funny, or it must be that new supplement. But if it happens repeatedly, especially if you're losing weight without trying or feeling full quickly, that's your cue to get checked. Why does this matter? Because the pancreas is your body's digestive powerhouse, and when a tumor grows near the head of the pancreas, it can block the enzyme flow, especially the lipase that breaks down fat. Without those enzymes, even a healthy meal can leave you feeling unwell, and your body starts to miss out on vital nutrients. Many people overlook this symptom for months, thinking it's just a food intolerance or gallbladder issue. But in some cases, it's pancreatic cancer hiding in plain sight, using your digestion as its first warning sign. Medical insight. According to the Pancreatic Cancer Action Network, enzyme insufficiency is incredibly common in pancreatic cancer, even early on. Many doctors now recommend checking stool samples for fat content if unexplained digestive changes appear, especially in adults over 50. Don't ignore changes in your digestion, especially if your bowel habits have suddenly shifted without a clear cause. If your stools are oily, float, or smell especially bad, talk to your doctor about pancreatic enzyme testing and imaging. Remember, your gut doesn't lie. And in the case of pancreatic cancer, your stool might speak before the tumor ever does. Number 3, itchy skin without rash. We all get the occasional itch, but what if you're scratching constantly and there's no rash, no redness, and no visible cause? It might seem harmless or even annoying, but it could be your body's early warning signal of something far more serious: pancreatic cancer. Here's what most people don't know. Persistent, unexplained itching, especially if it's all over your body, can be an early sign of bile buildup. And in some cases, that buildup is caused by a tumor growing in the head of the pancreas, the part that sits near the bile duct. When a tumor blocks that duct, it prevents bile from draining properly into the intestines. Instead, bile, and more importantly, bilirubin, a yellow pigment found in bile, starts to build up in the bloodstream. This is what causes that deep, uncomfortable internal itching. It's not a surface irritation like eczema or an allergy. It's your liver and skin responding to too much bilirubin inside your system. And here's where it gets even more concerning. Many people experience this symptom before any yellowing of the eyes or skin shows up. That means the itching can be an early sign, even before you realize you're becoming jaundiced. Let's break down the biology a bit more. The liver produces bile to help digest fats, and it sends it through the bile ducts into the intestine. But when the pancreatic tumor blocks this flow, bile backs up, and bilirubin has nowhere to go. It begins to seep into the bloodstream, and one of its first effects is widespread itching, especially on the hands, feet, or lower legs. Patients often describe the itch as deep under the skin or impossible to relieve. No amount of scratching helps. And unfortunately, it's frequently misdiagnosed as dry skin, an allergic reaction, or just aging-related irritation. So here's your tip. If you've been dealing with unusual, persistent itching and you can't find a cause, especially if you also notice yellowing of the whites of your eyes, darker urine, or lighter-colored stools, call your doctor. Ask about getting your liver function and bilirubin levels checked. This isn't about jumping to conclusions or panicking. It's about listening to your body. Your skin might be trying to tell you that your bile flow is compromised, and that could point directly to a pancreatic problem. The earlier you catch this, the better your chances of managing or even surviving pancreatic cancer. In many cases, this type of itching has been reported weeks or even months before diagnosis. So don't just treat the itch. Ask what's causing it. Number 4, unexplained blood clots, DVT or PE. Here's a symptom that surprises a lot of people. A blood clot, sometimes in the leg, sometimes in the lungs, could actually be your body's early warning sign of pancreatic cancer. Yes, really. If you or someone you know has had a deep vein thrombosis (DVT), that's a blood clot in the leg, or a pulmonary embolism (PE), a clot that travels to the lungs, and there's no clear reason behind it, don't just treat the clot, ask why it happened. Pancreatic cancer is one of the cancers most strongly associated with increased clotting activity in the blood. Doctors have known this for years. In fact, about 1 in 4 pancreatic cancer patients experiences a blood clot before their cancer is even diagnosed. This condition is known as Trousseau's syndrome, where blood clots appear in unusual places or keep coming back for no obvious reason. Why does this happen? Pancreatic tumors release substances into the bloodstream that activate the clotting process. These substances can trigger inflammation and increase the tendency of the blood to thicken and clot, even if you're not sitting still for long periods or on hormone therapy, which are common risk factors. So what should you watch for? Swelling, pain, or tenderness in one leg, especially the calf. Redness or warmth over the skin. A sudden shortness of breath, chest pain, or rapid heartbeat. These are signs of a pulmonary embolism, which is a medical emergency. Of course, not all clots mean cancer. They can also result from surgery, medications like birth control, or prolonged bed rest. But if you're generally healthy, mobile, and not on any hormone-based treatment, and especially if you're over 50, it's worth asking your doctor to investigate further. Here's a critical tip. If you develop a blood clot without a clear cause, don't stop at blood thinners. Ask your healthcare provider to run cancer-related blood tests, consider imaging, or look deeper into what might be fueling your body's clotting behavior. These clots are not random. In many pancreatic cancer cases, they show up months before any digestive or pain symptoms begin. Think of it as your body sounding the alarm before the real fire starts. This is why doctors increasingly emphasize looking at clots as a systemic clue, not just a vascular issue, but a potential sign of an underlying cancer. So please, if a clot shows up and doesn't make sense, don't brush it off. Investigate it. Could be your first and only chance to catch pancreatic cancer early. Number 5, chronic indigestion and bloating. Let's talk about something most of us over 50 chalk up to aging, that uncomfortable bloating or the feeling of fullness even after eating just a few bites. Or that familiar burning sensation in the chest, heartburn that just won't go away no matter what over-the-counter pills you pop. But what if I told you that constant indigestion and bloating could be more than just age or diet? In some cases, these could be early signs of pancreatic cancer. Here's why. As a tumor begins to grow in or around the pancreas, it can start pressing against nearby digestive organs, especially the stomach and small intestine. This can slow down or even block the process of gastric emptying. When food lingers in the stomach longer than it should, it causes that uncomfortable bloated feeling, especially after small meals. And when digestive enzymes aren't reaching your gut properly, the food can't break down effectively, leading to gas, fullness, and acid reflux. The biology behind it, the pancreas plays a key role in producing enzymes that help digest fats, proteins, and carbohydrates. If a tumor blocks or interferes with that function, even partially, you're left with poor digestion and incomplete breakdown of meals, which your body feels as bloating or discomfort. Can also interfere with the muscular contractions of your digestive system, slowing everything down. Now, does this mean every case of heartburn is cancer? Of course not. But here's where things get concerning. If you've been feeling this way for weeks or months and typical solutions like antacids, proton pump inhibitors, or dietary changes aren't helping, that's not normal. Here's your tip. If your stomach feels full way too quickly, you're dealing with persistent bloating, or your indigestion seems out of proportion to what you're eating, don't just brush it off as aging digestion. Especially if these symptoms are new or progressively getting worse. In fact, some patients report this type of bloating or indigestion months before any major pain, jaundice, or dramatic weight loss begins. That makes it one of the most under-recognized early signs of pancreatic cancer. So take your gut seriously. Don't self-medicate endlessly. Instead, bring it up with your doctor and ask for further investigation. An abdominal ultrasound, CT scan, or endoscopic exam can reveal if something more is going on behind the scenes. Sometimes what feels like just gas may be your pancreas quietly signaling that something isn't right. Number 6, back pain that gets worse when lying down. Let's face it, most of us have dealt with back pain at some point. But not all backaches are created equal. And some could be hiding something far more serious than a pulled muscle or a stiff spine. If you've been experiencing persistent back pain that starts in your upper abdomen and radiates to your back, especially if it gets worse when you're lying down at night, you need to pay attention. This could be your body signaling trouble with your pancreas. This isn't the dull lower back pain from sitting too long. We're talking about a deep, nagging ache that seems to burn or press from the inside out. Often, people feel it behind the stomach area, slightly to the left, and it may radiate to the middle of the back. It's especially concerning if the pain worsens when you lie flat and gets better when you lean forward, a very specific clue doctors look for. So, what's going on inside your body? A growing tumor in the pancreas, especially in the body or tail region, can press against surrounding nerves or even the spine itself. Pancreas sits deep in your abdomen, close to many important nerve clusters. When a tumor begins irritating these nerves, it sends referred pain signals that radiate to your back. This type of pain can be persistent and unrelenting. What makes it especially deceptive is that many people dismiss it as arthritis, a bad mattress, or age-related strain. But in pancreatic cancer cases, this kind of pain often shows up before any visible symptoms, like jaundice or weight loss, have a chance to appear. Doctors say it's a red flag when nighttime back pain is combined with digestive issues, such as bloating, indigestion, or loss of appetite. That pairing could be your body's way of waving a big red warning flag that your pancreas needs attention. Here's a crucial tip. If you're waking up with back pain or you can't sleep because of it, and you also notice digestive problems or recent changes in your appetite or weight, don't just reach for pain relievers or heat packs. Ask your doctor about getting screened. An abdominal CT scan or MRI can help rule out pancreatic problems. Remember, pancreatic cancer often whispers before it screams, and back pain could be that whisper. So don't just manage the pain. Investigate it, especially if it's new, persistent, and getting worse at night. Number 7, unexplained depression or mood changes. What if feeling unusually sad, anxious, or hopeless wasn't just a mental health issue, but actually a physical warning from your body? If you've been struggling with a low mood, irritability, or emotional swings that seem to come out of nowhere, especially if you're over 50, this may be more than just stress or aging. New research reveals that depression can actually be an early symptom of pancreatic cancer, even before any digestive symptoms show up. So, how is that even possible? This is where the brain-gut connection becomes incredibly important. Pancreatic tumors can release inflammatory molecules called cytokines, which enter the bloodstream and travel throughout the body, including to the brain. These chemicals may disrupt brain function, affecting mood-regulating pathways such as serotonin and dopamine. The result? You feel off, down, maybe even hopeless or anxious without really knowing why. This doesn't mean everyone with depression has pancreatic cancer, not at all. But if the depression feels sudden, unexplained, or very out of character, and it comes alongside other symptoms like unexplained fatigue, weight loss, digestive issues, or poor appetite, it's worth investigating further. Doctors and researchers are starting to notice this pattern more and more. In fact, some pancreatic cancer patients have reported experiencing emotional changes for months before any physical symptoms developed. It's often written off as midlife stress, menopause, or even retirement anxiety, but the body may be waving a quiet red flag. If you or a loved one have been feeling persistently low, anxious, or emotionally flat without an obvious cause, and especially if it's accompanied by signs like loss of energy, sleeping more than usual, or losing weight without trying, don't ignore it. Speak with your doctor and bring up the possibility of a deeper physical cause. In some cases, pancreatic cancer shows up first in the mind before it shows up on a scan. It's a reminder that your emotional health and physical health are deeply connected, and that sudden changes in mood can be your body's way of trying to get your attention. So if your sadness feels different this time, or if it just won't lift, don't suffer in silence and don't assume it's only in your head. Questions. Get checked. Early action could save your life or someone else's. Number 8. Ascites abdominal fluid buildup. Have you noticed your belly looking more swollen or bloated lately, even though you haven't been eating more or gaining weight? Maybe your pants suddenly feel tighter around the waist, or you feel a strange fullness in your abdomen that just won't go away. If this sounds familiar, don't just blame it on aging or gas. Could be something far more serious, a condition called ascites. Ascites is the medical term for fluid buildup in the abdomen, and it can sometimes be one of the later warning signs of pancreatic cancer, especially when the disease has begun to spread or interfere with surrounding organs and vessels. What should you watch for? A feeling of tightness or heaviness in the belly, visible swelling or distension of the abdomen, loss of appetite or early satiety, feeling full after just a few bites, clothing fitting snugly, especially around the waistline, a sense of pressure or discomfort when lying down or bending over. This fluid buildup often occurs because pancreatic tumors, particularly in advanced stages, can block the flow of lymphatic fluid or irritate the lining of the abdominal cavity. The result? A slow and steady accumulation of fluid that leads to noticeable swelling. What's tricky is that many people dismiss this symptom as gas, bloating, or even normal weight fluctuation. But here's the difference. Ascites doesn't come and go easily, persists, and sometimes even worsens over a short period. You might feel like you're gaining weight, but the scale barely changes. The science behind it. As pancreatic cancer progresses, it can trigger inflammation in the abdominal lining, the peritoneum, or impair blood flow through the liver and nearby vessels. That imbalance causes fluid to leak out and collect in the abdominal cavity. Here's the tip that could make all the difference. If you're noticing abdominal swelling, especially when it's paired with symptoms like fatigue, back pain, or loss of appetite, don't wait and see. Get it checked out. A physical exam, ultrasound, or CT scan can often detect ascites and lead doctors to investigate the root cause. And while ascites doesn't always mean cancer, it can be caused by liver disease, heart failure, or infections. It's never something to ignore. Unexplained abdominal swelling deserves attention. 'Cause in the fight against pancreatic cancer, the sooner you connect the dots, the better your odds of early intervention. So don't overlook what your belly might be trying to tell you. Sometimes it's not fat, it's fluid. And that small detail could be your biggest clue. Pancreatic cancer is often called a silent killer, but the truth is, it's not completely silent. Your body whispers clues long before the loud alarms go off. Key is learning to recognize those whispers. These 8 symptoms, unexplained diabetes, oily stools, itchy skin, blood clots, bloating, back pain, mood changes, and abdominal swelling, aren't random. They're your body's way of waving a red flag. Don't wait until the pain is unbearable or the fatigue becomes disabling. Early detection saves lives. Pancreatic cancer found at an earlier stage is more treatable and gives you more time and more options. Take one step today, book that doctor's appointment, share this video with someone over 50, and most importantly, stay informed, because what you know could protect you or someone you love. Which of these symptoms surprised you the most? Have you or someone close to you experienced any of these signs? Comment below, we'd love to hear your story. Like this video, subscribe for more life-saving health tips, and hit the bell icon so you never miss an important update. Your health is your power. Let's protect it together.